Is your practice tired of wrestling with insurance denials, deciphering EOBs, and watching your revenue slip through the cracks? You are not alone. Welcome to The Claim Game, the podcast designed to cut through the confusion and provide you with the best practices for revenue cycle management success. We are Jeremy and Catherine Zug, and we've been with people just like you in the trenches. Each week, we'll break down complex billing processes, share real-world solutions from practices like yours, and ask questions of the game makers and changers of healthcare so you can take control of your revenue. Let's turn those claim denials into deposits and help you return to focusing on patient care. It's time to win the claim game.
Hey everyone, welcome back to The Claim Game. I'm your host, Jeremy Zug, and we're in the Claim Game studio. And if you've been with us this season, you know we've been slowly and systematically picking apart each of the billing domains in revenue cycle management, one domain at a time. Last time we were here, last episode, we wrapped up eligibility and benefits. There's a complicated territory. There's a lot going on there, and it's really important to get eligibility and benefits right. And remember, each of these domains is your billing domain, and getting them right means that you're sustainable for the long run, whether that's to move on your mission, whether that's to grow your practice, whether that's to hire more, whatever that is, whether that's just to take more time off. And to master these billing domains means to move on your goals. We are zooming in. We are looking at each of these domains closely, and we are going to tell you the strategies to win with confidence and with ease and claim victory for your practice's bottom line. If you missed the initial setup and want to understand the full scope of how each of the 6 billing domains operate and move together, be sure to check out episode 1 for the complete overview. Today, we're going to introduce a new billing domain, and this is a very, very important one. And I think it's important before I launch into the next domain to talk through, as we walk through these domains, they are built in the order that we'd like you to do them. We know billing is not hard. I know that's shocking, right? Insurance and credentialing and all this stuff, how it all fits together, may seem complicated, but do you want to know what we know? We know that with the right orientation, the right structure of your systems, this actually is not that hard. And so as we move to the next domain, you might think it's out of order, but it's not. We can talk about that a little bit at the end of the episode. So to introduce the next domain, we are going to launch into payment posting. And I want you to imagine that you're playing a high-stakes game of Monopoly. Now, Monopoly is an interesting game because it takes forever. But let's say you've bought the properties, you've built the hotels, and other players are landing on your spaces, and you're rocking and rolling. But when it comes time to collect the rent, whoever the banker is shrugs and tosses you a fistful of money and refuses to tell you if it's what it's for, full amount, partial amount. You would not respond well to that, especially if you've invested the 4 or 5 hours it takes to play that game in particular. I think you'd flip the board, yeah? But that's exactly that process of you're doing really well, somebody hands you a fistful of money, and you kind of just move on. That's exactly what thousands of practices do every single day with payment posting. They see money hit the bank, they high-five each other, and they move on to the next thing, the next fire that's burning. But what they don't realize, and this happens all the time, what they don't realize is that they've just accepted 60% of what they should have been paid, 85% of whatever they should have been paid. And they let a payer or a patient go, and they don't maximize reimbursement on what is essentially a technicality. And in this episode, we are going to high-level overview payment posting, and we're going to show you how to turn your payment posting process into a scorekeeping machine that is really essential to the life of your practice. And it's essential that we go from eligibility and benefits to payment posting, not eligibility and benefits to claim submission. So we're going to uncover the workflow of explanation of benefits and electronic remittance advice. We are going to look at payment posting, denial documentation, KPIs. We're going to do the whole kit and caboodle here with you over the next several episodes. And you'll want to stick around because we have case study after case study, example after example of what it looks like when a practice takes the fistful of monopoly money and does not meticulously go through it to make sure that they are paid what they should be paid. So let's get started. And I think the best way to talk through payment posting is just doing a territory overview, a domain review, right? Let's define it. What is payment posting? And in the context of like a game board, for example, if patient registration is you're setting out the pieces and you get everything all set up, and eligibility is the rules of the game. Payment posting is an audit. It's a scoreboard. It's scorekeeping, right? And it's the moment, this is where rubber meets the road with a lot of billing, right? Everything up to now has a heavy lift sort of leading to payment posting. Payment posting is a reconciliation of your expectations and understanding of the contract and CPT codes and credentialing status versus reality, right? You send a claim saying that I did this service, I'm going to charge $150. I'm expecting the payer to pay $120 for my allowed amount, and the payer responds with a check or a denial. Payment posting is the process of logging that response in preparation of a resolution. It is not the resolution itself. We're going to get that to resolution to action in aging follow-up. But you are just logging the response. You're logging it. You're getting it down. And you're organizing yourself to take action. You aren't doing anything other than that. Now, you might be thinking, all right, Jeremy, this sounds like data entry. It sounds boring. Is this really necessary? Why can't we let's move to the good stuff. And I'm here to tell you, do not treat payment posting like data entry. If you treat payment posting as a clerical task, or you see it as lesser than the other domains of billing, you're really vulnerable. You're putting yourself at risk. You need to treat this domain as financial intelligence, right? This is where the financial support, financial backbone of your biller, and maybe even your CFO or bookkeeper really comes into play. And this is, for us, it's very exciting. This gets our blood pressure up in a great way. And we are going to find out which payers are dragging their feet, which CPT codes are triggering audits, which front desk staff members are maybe neglecting to collect copays. We really have some fun in payment posting. Okay, this territory has 4 distinct moves. So 4 actions that occur in the macro, right? There's a lot that happens from a keystroke level. But for today's episode, I want to talk to you about the meta view of payment posting. And the first move that you make is receipt. So you gather the payment detail. Insurance companies pay you. They're not paying you a 1 check or 1 EFT deposit per session. They're going to collect the aggregated sessions for a certain time period and pay you in a bulk check. And the way they communicate the detail of that bulk check is through an explanation of benefits. As a patient, you've probably received an explanation of benefits, right? We tried to go on a cruise once and we had a slight incident that resulted in some stitches, story for a later time. Months and months later, we received an EOB outlining you were here on this date at this time, you got this procedure, etc. And then this is what you owe. So as a patient, that's what an EOB looks like. As a provider, your EOB is, we paid you $10,000 with this amount going to this patient for this date of service. We denied this date of service for this reason, etc. So that's an EOB. The electronic version of that is called an electronic remittance advice. EOB, in the mind of your biller, this is nerdy talk now, but in the mind of your biller, EOB says paper, ERA says electronic. Same info, different format, different method. ERAs are better. We'll just say that right off the top. So that's the first move. You got to receive payment and intelligence around where that payment is supposed to go. Second, you have posting, right? Like the actual process of payment posting, right? You apply the funds to a specific line item. Then, and this is the fun part, you have to capture denials. You have to know which claims had a $0 payment. We'll say that a lot. $0 payment isn't obviously not a payment, but it could be a denial, could be a deductible, could be something else, right? But you have to capture what that looks like and what those are and what the reasons are. And then finally, we have KPIs, right? In every domain, you're going to learn this about me, Catherine, and the rest of the team at Practice Solutions. We love data. And I think we would love to instill a love of data in you too, because it allows us to look under the right rock for whatever you're looking for. So, and here's the deal. If we get payment posting wrong, if we fail here, your patient statements are wrong, your receivables will be inflated, and this whole thing, billing, revenue cycle management, gets real complicated really fast, especially at scale. So if you're one of these like agencies, practices, organizations that are looking for explosive growth and you get this process wrong, you are going to know for sure. And I'll just make a quick side note here. The number one denial reason in all of healthcare in the country is duplicate claim submission. Now, that denial exists. That's not really a denial you can fix, right? That's a denial pointing to another denial. And that denial reason is entirely preventable, but it requires this process to be forensic and academic in nature. All right, enough about that. Those are the 4 distinct movements you make in payment posting: receipt, posting, denial capture, KPIs. Great.
One mistake in your notes can cost you a reimbursement. Blueprint helps providers avoid that by writing smarter documentation, flagging issues early, and getting claims out the door faster. Check the show notes for the link to give it a try for free.
Moving forward, we're going to talk about the workflow. So those are the actions, but how do they fit together? What is the art of posting? Every repeatable process in revenue cycle management comes from a solid workflow. We can't control payers, we can't control patients, we can't even control clinicians. What we can control though, and this is why we're hammering away at this, is you can control your workflow. You can control the tasks that get done in each domain of revenue cycle. And so the step 1 is intake. You have money coming in from either paper checks, patients, and electronic deposits, right? So the EOB, we've talked about this. It's a paper trail, snail mail. It's slow, it's manual. And you know what? It's prone to human error. If the mail doesn't get delivered, if there's snow or ice, or, you have somebody who goes out of town, right, and they don't pick up the mail, they don't tear out that check, you don't deposit it. And then when you post it, right, you can miss a page, you can miss a patient. It's real complicated. I started doing manual revenue cycle management when I was in college in Chicago. And the private practice I was with, Harris Clinical Group, they're amazing downtown. And we would get, and all of you know what I'm talking about, a 2-inch thick pile of Blue Cross Blue Shield EOBs. And my process then was I had a highlighter and I'd highlight it, or I would have a red pen cross out the patient every time I posted it, because it was so easy in all of the detail and all of the noise on an EOB to miss it. So that's an EOB. Can you tell what our opinion is on those? We don't really like them. And then ERA, we've talked about this a little bit, electronic remittance advice. It's a digital stream. It's a technical name for it is an 835 file. It's what the payer says to the clearinghouse that connects to your EMR says, right? The goal in this territory in receiving payment is to migrate as much volume as possible to ERA. And ERAs, the reason for that, a lot of electronic health records, EMRs, are starting to do auto posting. So they'll fill in a lot of the detail. They do a lot of the keystrokes. So you don't have to do the pen strategy on these things. And that saves a lot of time, somewhat fraught with peril, but it does save a lot of time. If you're manually keying in every single check, you're just playing in hard mode, right? For no reason. Step 2 in the workflow is posting, and this is where we see good practices make bad moves. Excuse me. They get a check for $500 for a patient. They post a lump sum to the patient's account, and they move on. Do not do that. That's a terrible idea. Because it's going to wreck up everything else. What you really need for somebody to do this process, you need 2 things: time and a nerd. You need somebody who's really detailed, and there are hosts of people out there that love doing this. So if you don't love doing this, don't do it. Outsource it, find somebody internally, but you need somebody who's almost over compulsive about this stuff. The best practice for posting is line item posting. you have to match the payment to a specific date of service and the specific CPT code. We'll talk about intricacies in a minute around secondary claims and what to do about that and how to post those. And it can all be a big mess, but it doesn't have to be. So and that's a little bit of what I was talking about for secondaries. But imagine, right, you provided multiple services on the same day. For example, the insurance pays for one service and not the other. If you post a lump sum, the system thinks everything's fine, and you might miss a denial, you might miss a chance to appeal. But by posting to the line item, you create clean claim data, which is really great. If your current biller is bucket posting, so that whole like throwing a wad of money at a patient's account, pause the podcast, walk over to their desk, ask them to stop that, and then revisit the Claim Game podcast or the Hourglass and walk through creating the right workflow so that stops. You can get better data that way. All right, next is denial documentation. Let's talk about this some more. So this is the most dangerous, most risky part of the domain. This is where the like go to jail cards come from. In our previous episodes on eligibility and benefits, we talk about how a good E&B check prevents surprises. Doesn't stop them, but does prevent them. But even with the best E&B process, denials happen. They do happen. It's going to be a reality of taking insurance. You have to make a decision when you open your practice and you decide to go in network with insurance if that's something you need or want to deal with. If you don't want to deal with denials, do not take insurance. They're just part of the game. So here's a golden rule for this domain. $0 payment is still a transaction. When you receive an ERA or an EOB that says $0 paid, you don't move on. You don't ignore it because the problem only gets bigger. You have to do something with that zero. And more importantly, you have to document, if it is a denial, you must document the denial code. So there are codes. There's codes for everything, CPT code, ICD-10 code. There are also denial codes. They're called claim adjustment reason codes. So when you send a claim to insurance company Y and they respond with a payment, but they don't pay your full fee, they must provide you a reason for every cent that's not paid toward your full fee. So they're called CARCs or CARCs, whatever. CARCs sounds like carcass, which maybe that's an apt name for these. A claim denial reason, for example, would be CO-45. It's a contractual adjustment, right? You may charge $200 for your service, but the contractual adjustment, your fee schedule, says 145, 143, 157. Who knows? So they're not going to pay the difference between your contracted rate and your cash rate. That amount you write off. Can't pass that on to your client, not passing that off to anybody. You lose that. And then you should talk to your accountant about how to document that. Or PR-1, for example, that's a patient responsibility or deductible. That's where you bill the patient for the amount that the EOB or ERS says you need to bill your patient. Easy peasy. Or is it CO-16, claim service lacks information? And here's what you're going to find out real quick. There are a bunch of claim denial reasons, and they're not clear. There's no requirement for them to be clear. And I'll give you another inside track here. Insurance companies, when they look at a claim, they may know that there are 5 things wrong with that claim. Do they deny all 5? Nope, they sure don't. They will deny one denial at a time, which is sometimes why when your biller is working really hard to resolve a denial, that same claim will come back with a different denial. And you might be inclined to say or think my biller's not doing a good job. And that may be true. I don't know. We'd have to look at that. But it could be that your biller is just part and parcel living in the system that's here. Insurance companies could make our lives a lot easier by denying all the denial reasons so we can fix it. But that's not to their benefit. So at any rate, you'll want to make sure you track those. We'll talk about that in a little bit. But these claim adjustment reasons separate cash flow from recovery, right? Paid versus I need to follow up on this. And if you don't document the specific code at the time of posting, you're forcing your billing team to reinvestigate the claim weeks later. If you resubmit that claim as a denial, it's just going to deny again. Then you got to do some more digging. You can see how that compounds on itself, and that's just wasting time. So this is, in the context of a game, right? You're moving backward. You're not moving forward. All right, and then KPIs. It's the last part of the workflow here. Before we get to the case study, I want to look at some metrics. How do we know that you're doing a good job at managing the inflow and outflow of denials? So there's 3 metrics, right? We're not going to make this complicated. I want you to be able to hear these and implement them. We'll talk more about KPIs in another episode, but talking about net collection rate, this is a big one. Of the money you are contractually allowed to collect, how much did you actually get? You want to target 95% or higher, right? And again, why not 100, Jeremy? Shouldn't we get paid for everything we're owed? Sure should. You bet. But insurance companies are going to insurance, right? And they're going to do things that to control the spend. And so hopefully you're perfect. I know a few practices that are perfect, but not many. So you want to target 95% or higher. If you are at 85%, it is likely that you are leaking revenue. The next metric that you want to look at in this particular domain is days to post. This measures the speed of your team from the moment that an EOB or ERA comes in to how soon it's posted in your system. You want to know what the lag is on your data, on your analytics. Our rule of thumb here is that you don't want to go more than 2 weeks, or the aging, the receivables report becomes a lie a little bit. And let me give you a little bit of a paradigm or a tricky wicket. Sticky wicket? I think it's sticky wicket. ERAs and EOBs come in sometimes at different rates to cash in the bank. And sometimes they don't come in at all. And so you have to manually post payments. Your bookkeeper or CFO is going to have a big problem here with your billing team, because those reports, billing and your P&L, won't always match. So you have to figure out a cadence or a system that doesn't bother either party, but allows you to do your work really well. So that's something we'll talk about. There's not a perfect system there, but it's important to know. And the last metric you should probably be tracking is first pass denial rate. And that tracks that the question that's asked is, what percentage of your claims are getting denied on the first submission? And again, you want to target less than 5%, right? If this is high, you need to go back to eligibility and benefits, credentialing, patient registration. You need to go back to a previous domain of billing and find out what's wrong. And we need to fix whatever's going on there. Okay, let's talk about a case study on a practice that we recently started working with, that when we started working with them, this kind of situation demands immediate attention. So we had a group practice come in. They weren't doing a lovely job of tracking payment posting. Nobody was really managing the process very well. And what they found was the reason they turned to us for billing help was that they had around $78,000 in receivables that they didn't know what to do with. They didn't know if they were denied. They didn't know if they were paid. They were looking at the denials, and they estimated their denial rate to be upper 30%, which is not good. And after about 2 to 3 months of working with our billing team, we recovered most of the $78,000, and we were able to get their denial rate below 5%. And we don't say that to highlight ourselves. I say that to say, if somebody's not focused on this process or this workflow, that's how out of control this can get. And a lot of those denials were things like incorrect ID numbers, missing modifiers, things that are easily fixed on the surface. But if not managed in a high volume situation, you end up with like a tangled up ball of yarn, and you just need somebody to sit down on the couch and untangle that thing so that you can actually move forward and collect what you should get paid. So they didn't have to write off very much, and we collected the rest. But when we look at payment posting issues and denial documentation issues, we're not talking about the monopoly money analogy from the beginning of this episode. We're not talking about fake money. We're talking about salaries, talking about bonuses. We're talking about expansion capital. And sometimes if you wait long enough, that is just gone. You can't recover it. And that's the most heartbreaking scenario that we see, is when we have to write off all $78,000 because we didn't catch it in time. That should not happen. So we want to make sure that we're being very forensic, we're being academic, we're being dogged, detailed when it comes to payment posting. So to recap our episode, we covered high-level processes for payment posting. You want to gather your intelligence through ERAs, you want to post accurately, you want to capture denials, and you want to track your process. It's not just about closing out balances and making a receivables report look good. It's about learning how to play this game better every time. Next time on the Claim Game, we'll be interviewing my friend Dylan Ross to talk about Getting Paid with Measurement-Based Care. He's a brilliant guy. He's been a mover and shaker in healthcare for a long time. It's an interview you really won't want to miss. I'm your host, Jeremy Zug. Thank you for joining us. We'll see you next time here on The Claim Game. If you enjoyed today's episode of The Claim Game, please take a moment to leave us a rating and review wherever you listen to your podcasts. It really helps new listeners to find us. Make sure you never miss an episode by subscribing to The Claim Game on your favorite podcast app. Your feedback means so much to us. We want to provide valuable education about revenue cycle management. So if there's something we didn't cover in our topic that was a burning question for you, please let us know so we can try to get you the information you desire. You can find the links to all resources we mentioned in this episode in the show notes. And if you want to dive deeper into our resources, we have two places you can do that. First, you can go to our blog at practicesol.com/blog, where we have 8 years of educational blogs. If you want to learn more about what Practice Solutions does, reach out. We'd love to hear from you. Just go to practicesol.com to learn more and to connect with one of our awesome people on our team. Thanks for listening. We are Jeremy and Catherine Zug, and this is The Claim Game. See you at the game table next time.